Today I'll answer a query asked by our viewer why it is important to do a 6-week scan or early pregnancy scan. Hello everyone, I'm Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. So 6-week scan is also called as early pregnancy scan. There are many things which we come to know on a 6 weeks or early pregnancy scan. First and most important is the location of the pregnancy. Then the duration of gestation, which means how the baby is, how much is the size of the baby is, which we consider in weeks. So this we come to know on the first scan. This is also your baseline scan so that I can have a date to monitor your baby's growth. So based on the first scan or early pregnancy scan findings, we date the pregnancy because the first trimester scan is the most accurate for the measurement of the baby and also to measure the gestational period or the pregnancy period. Now coming to the another aspect, which is also there can be other findings, like there might be subchorionic hemorrhage, or there might be short cervix, or there is something called as heterotopic pregnancy, which means the pregnancy is present not just inside the uterus but also outside of the uterus. So there are two locations of the pregnancy: inside the uterus or sometimes in the tube in the previous cesarean scar area. So whenever there are two pregnancies with different locations, they called as heterotopic pregnancy. Now first trimester scan which we do, we see the location of the pregnancy. Normal location of the pregnancy is inside of the uterus. So this is called as eutopic. So whatever is not inside of the uterus, we call it ectopic pregnancy. Like suppose if the pregnancy is implanted into the fallopian tubes, either right or left, it is called tubal ectopic pregnancy. If it is implanted in the cervix, it is called cervical ectopic pregnancy. If it is implanted in the cesarean scar area, it is called scar ectopic pregnancy. Also, there is ovarian ectopic pregnancy, abdominal ectopic pregnancy. So, this is the abnormal location of pregnancies. Pregnancies in these areas will not develop normally, and most of the times, if they continue growing, they lead to complications like severe bleeding, internal bleeding, sudden fainting episode requiring emergency procedures like laparoscopy and tubectomy or removal of the ectopic pregnancy. So it is very important that you do early pregnancy scan to know that your pregnancy is growing inside of the uterus and there is no ectopic or heterotopic pregnancy. Second thing which is important is we date the pregnancies based on this scan. So first scan, which is 6-week scan, is considered more accurate because we measure the fetal pole, which is CRL, we measure the gestational sac, and based on these measurements, we further scans we date to see if the baby is growing appropriately. If after few weeks there is problem in the baby's growth, then we can detect it early and we compare it to the first or early pregnancy scan to see how much is the growth lag. So even diagnosis of IUGR or intrauterine growth restriction, the first trimester or early pregnancy scans are helpful. So this is about the 6-week scan or early pregnancy scan. Other things which I mentioned like subchorionic hematoma and short cervix, these things also increases the risk for miscarriages. If there is any issue, sometimes doctors prescribe medicines like progesterone supplement or bed rest based on these scan findings. So if we know about the complications early, then we can manage them more effectively. We also have a scan to decide the growth of the baby. So this is why the first trimester or early pregnancy scan is important. I hope this was helpful.